I'm good, good. Good morning, and I'm glad that your shirt says Wednesday so that I know what day it is. I think just to be ironic, you should wear that on a Thursday and just confuse people.
I do that a lot. I wore Friday yesterday, and someone would say, "Don't lie
Okay,
to children. It's a
okay,
it's a Tuesday, not a Friday."
yeah,
How
yeah,
what's the feel like today? We have a great hero joining us on the
yeah.
COVID-19 Heroes.
Yes. So, you've already said who it is. This is actually what we're rounding out the show now. So this
Okay.
is actually the last episode.
Woo.
So it's a perfect way to end it with the man who's at the forefront,
That's right.
and who's become a household name. So it's
Mhm.
Dr. Chikwe Ihekweazu, the DG of the Nigeria Centers for Disease Control. Thank you very much for taking time to
Yeah.
be with us today, Doctor.
Well, thanks a lot. It's great to be on this show. Great to speak to Nigerians. It's a major part of our responsibility is to connect to ordinary Nigerians across the country every day. So really great to be on the show. And thanks for the great work Nigeria Info is doing.
Thank you.
So listen, Dr. Chikwe, I mean, Nigerians need to know this, that you're also a huge Super Eagles fan. In 2018, we actually were basically sitting next to each other in the Nigeria-Argentina match. And hopefully we're gonna be together in Qatar in 2 years. I hope we'll all be able to be there. But listen, just obviously Nigerians know you as the DG of NCDC. But tell us a bit more about your background before you got there, and what you've been doing before to prepare you for this amazing role.
So thanks. I remember sitting on that game. It was probably one of our most painful games when we dropped out of the World Cup. But why it's important for this conversation is if you think about the camaraderie that we feel during football games in Nigeria, if we just had some of that in the rest of our national life, the country would be a different place.
That's right.
This role and my journey to this role really has been a lot of, timing and opportunity. Very few people study medicine with a view of going into public health, right? You generally study medicine to be a doctor, a clinical physician, to focus on the patient in front of you. And to be honest, that was my dream as well. But when I had the opportunity of leaving Nigeria, I struggled really with, just the cramming that was necessary for medicine. I wanted to expand my thinking a little bit more and, find solutions for health challenges on a population basis. So, I did a master's in public health about 25 years ago, and kind of happened to have my first job at the National Public Health Institute in Germany. So, when you're applying for your first job, you're not focused on one place. You send out 100 applications to whoever will take you. And it just happened that RKI, the Robert Koch Institute in Germany, was, the first job I landed. So kind of from there, I've only ever worked in National Public Health Institute. So I worked in Germany, the National Public Health Institute in the UK, called the Health Protection Agency. I moved to South Africa, worked there for about 3 to 5 years at the National Institute for Communicable Diseases. And then when I received a sudden invitation when this government came into power to support them in building up Nigeria's nascent NCDC, I wasn't aware that anyone had targeted me for that role. It came as a surprise, but it also came as the biggest privilege of my life so far to lead this institution. A fairly small parastatal when I was appointed in 2016. But in 2018, we're thrown into this pandemic and with the responsibility of carrying the burden of Nigeria's response. And we're focused on doing that ever since.
Well, you assumed the leadership of the NCDC in 2018, right? How's the journey been so far?
Yeah, actually, the funny thing is I was appointed in 2016.
Oh, 2016.
Yes, but note this, I was appointed to an agency without an act, without a mandate, without a legal framework. So it was a very strange appointment, so to speak. I even my tenure could not be defined because there wasn't an act that defined the tenure of the chief executive. So the first thing I had to do was take a bill through the parliaments of Senate and our House of Reps to actually legally establish the organization. So the organization was established in 2018, and in 2019, I was then appointed formally as the first Director General. So it was a strange journey in formation. But what we did is when you're appointed into a young organization, there are challenges and opportunities. The challenge is that we had, at the time, very little to work with. We had a few staff, but the opportunity is that you have an opportunity to build, right? We didn't come into a formed ship that is difficult to shape. We had the opportunity to build, to recruit young, talented, mostly young, talented Nigerians to drive this organization. We had the opportunity to build in information technology right from the beginning of our operations. We had the opportunity to start building up our lab infrastructure, yes, from a very low base. And that's what we've done. And, I know the public sector gets a bad rap in many, in our national discourse, and, everyone thinks that nothing works and nobody's interested. But, I think I've had a completely different experience here. We've actually been able to build up a group of people that are completely dedicated to the work they're doing. Yes, it's not perfect, but I'm fairly confident that we're on the right path, and we have a group that is, committed to protecting the health security of all Nigerians, and wake up every morning with the desire to improve the work they're doing.
Very interesting.
So Dr. Chikwe, you've been at the front lines now for 8 months with the public health response against COVID in Nigeria. And I mean, like we said, you've become a household name. You're Nigeria's Dr. Fauci, I guess. But from your work so far, I mean, are we at the peak? Are things going to start getting better? I mean, what do you want to tell Nigerians about where we are and what we need to still be watching out for?
Yeah, so, it's been a tough 8 months,
Yeah.
Most outbreaks that we've dealt with, even the Ebola outbreak, we were fairly confident that we could get to the peak very quickly, crash it to the bottom, and, all the other outbreaks we've worked on, has always been this. But with this new virus that is so well adapted to transmission in human populations, it's been very difficult, and we just have to accept that, until we have a very good vaccine, we can't drop the ball completely. So we've done a fairly good job to manage this outbreak, not to lead to the explosion that many people predicted would happen in Nigeria. We worked very carefully with state governments and the national government, implemented lockdowns. And, people say, yes, it became weak. But in the early days of that lockdown, the country really shut. And I think that is what bought us the time and the opportunity to then adapt the response to get us to where we are. Now, it's very hard to say if we're at the peak, because we have seen the number of cases, they have come down, but we are in the midst right now. We've just opened international travel. Most states are about to reopen schools. So we are the NYSC camps are about to open soon. So there are many opportunities for increased transmission. And we have to keep at it to really see that we do not lose the gains that we've had. And this is a very delicate balance, because we also know that we have to reopen the economy, reopen our life, but we have to at the same time mitigate this risk. So yes, I think in summary, we have been fairly successful collectively in managing this and preventing, an explosion of cases as we have seen in India, in Brazil, in Argentina, countries that are not too dissimilar to us. But those gains are very fragile, and we cannot drop our guards too soon. We've got to keep at it as best we can until we at least have a vaccine with which we can then really confront the main challenge of preventing infection.
Well, I wanted to give us an insight into some of the activities, especially, but you said you've done a good job. Do you think I believe you've done a good job? Yes, I think you have done a good job, because at some point Nigeria Info was almost turned to NCDC. So what's happening now? What's going on? What are they saying? And of course, we kept tabs with your activities, and I can say for sure that you did a very good job as far as that's concerned. So yes, saying it yourself, it's also still in line. But give us some insights on the daily activities at the National Emergency Operations Center, because I can't just imagine what that center would look like during this period.
Yeah, thanks, Sharon. When I say we, I actually referring to us collectively as Nigerians, because this is not really what NCDC has done. And I try to say that, we've worked with state governments, with the private sector. The work that the private sector has done, if you think about how they've come together under the COVID arrangement with the Nigerian big corporates, is really a story that will have to be told at some point. Because rather than fighting for influence and, I've given more than you, they've organized themselves, come together to support the response in a very strategic way. There are state governments that haven't waited for NCDC and have been so proactive. The story of Lagos State will be told at some point in how much the governor and his team have led from the front. So the we really is a collective. At the Incident Coordination Center that is now activated at its maximum at level 3 and has stayed that way, every day, whether it's in the press or not, we are looking at the numbers, we're responding, we're planning. Tomorrow or later today, in fact, we will have a big announcement about the number of labs that are now activated across the country. So we continue looking at the data, responding to it both proactively and reactively. So there are things we're doing proactively every day, and we have to assess success. There are other things we have to react to where there's a new incident. And we're working with so many partners. We're working with NYSC at the moment to plan towards reopening of their camps. We're working with the Ministry of Education to work towards reopening of schools. So with the law school, so there are many parts of life in Nigeria that are now kind of integral to working with different parts of NCDC to ensure that they can safely work and reopen the activities in a safe way. So it's been an exciting time at NCDC, at the EOC, but it's also, to be honest, been quite draining. The staff that have been at this, and sometimes right now I'm struggling finding ways to give people a break because, it's been 9 months, there's no end in sight, and we have to keep people somehow motivated to keep pushing. So it's a fine balance between the adrenaline and ultimately building a sustainable response that can carry us to the end of this.
Right.
So, Doctor, and actually, when you were coming on this show, what you're saying about being drained and all that. I mean, you look actually refreshed, and I'm glad to see that because I know Nigerians have been praying for you and everything because you need strength in this period, and I'm glad to see that you're still strong and energetic. But where are we now? You said there's a big announcement coming this later today, so you can't say all of it. But with the scaling up of the response, I mean, one of the things that has expanded dramatically across Nigeria is testing. So how has that been accomplished, and are you pleased with where it is now?
So we keep building. Like I said, we started from a very low base, but I'm very conscious that we can't lose this opportunity in terms of building our response architecture because if we had another outbreak, and as hard as this is to say, this will not be the last big outbreak we will have to face, right? I know this is a difficult message to communicate, but we live in a highly densely populated country in the middle of the tropics. There's no better place for viruses to emerge and transmit than Nigeria in the world. So we have to prepare for this. And so as we have rolled out and supported the acute response, what we've been doing is make sure that every lab in every state is prepared not only for COVID, but really for the future. So more technologies are evolving, we're putting them into place. I'm fairly happy about where we've gotten to, but I am aware that in Nigeria, just like with every other aspect, it's the acute response. We're fairly good at that. We showed that during the Ebola response. Yeah. We show that whenever there's a national emergency. The harder part is how to build a sustainable network that is always ready to respond. And that really is where we want to get to. That's our national challenge, whether it's an area that I have interest with you. If you look at our national stadium in Surulere or the one in Abuja, if we need it ready for a game tomorrow, we will get it ready. But will it be ready for a game every single day for the next 10 years? That's the big challenge. And so that's really what we're trying to do at NCDC, to make sure that we build a culture of responsiveness and preparedness so that we're not caught unawares when the next outbreak of an infectious disease emerges.
All right, if you're just joining us, you're listening to Nigeria's number one for talk. It's 99.3 Nigeria Info. It's 11:47 from the heart of the African continent, Lagos, Nigeria. And we're having this grand finale of a conversation, if you like, of COVID-19 heroes. And we do have the DG of NCDC. Now, my next question to you, Prof, is that as of Monday, the 5th of October, the number of confirmed cases reported was 59,465. Many Nigerians, of course, many people assume that Nigeria should have had more confirmed cases. I've heard people like, that number, are you sure? Are you sure? So what are some of the reasons that COVID has not spread widely in Nigeria?
So that's the million-dollar question. But there are few things that have happened, and which of them, how much each of them have played a role, it's up for debate. One, we did act very quickly in shutting the international airports, because the speed of spread doesn't just depend on one or two people. It really depended on how many initial seedings of this infection happened in our country, right? And we think that we shut the airports just in time before we got to a tipping point where it now became irrelevant whether he shut or not. So that's the first thing. The second thing was the very aggressive shutdown that happened across the country for almost a month, where there was almost no movement and therefore further reduced transmission. So that was in terms of the response. There are also things in terms of how we live, our population structure, how we live. A lot of the transmission that happened in many countries in the West happened because there are lots of care homes and lots of older people live in institutional settings. Transmission is very difficult to prevent in those institutional settings, which led to a lot of transmission among the most vulnerable, the older people, and they then filled out the hospital spaces. So, there are many of these factors, and we will eventually see how all of these factors play together to lead to the numbers that we have. But the numbers that we have, I've heard a lot of people say, are those real? Listen, we have continued to test aggressively. Yes, there's a bit of testing apathy right now, but every day, there's hardly any other figure in any other industry in Nigeria where numbers are reported every single night, and we haven't missed a single day since the beginning of this outbreak. We are open and honest with Nigerians around the number of tests, the number of positives, the number of deaths. And it is where it is. Yes, there may be a few more cases, but listen, look at our treatment centers in Lagos. Many of them are shutting down because we don't, if we're having cases, we would have a number of severe cases that require hospitalization, but we're not seeing those cases anymore. So we are fairly confident that the figures, even if they're not 100% accurate, that they're a fair representation of the trends of cases in Nigeria. Our collective challenge is to keep it that way and not to kind of doubt the figures all the time. We need to keep at it, and that's where each of us has a role to play over the next few months as we work towards a vaccine.
Right.
So doctor, you've mentioned some of this earlier, but international airports have reopened. Schools are going to open. You talked about NYSC camps. So what is the NCDC doing to make sure that as these transitions happen, we are still safe in Nigeria?
Yeah, so this has really been the heart of our work over the last few weeks, working with schools, working with NYSC camps, the military. There will be some changes in terms of how we manage our schools and all these closed settings, prisons, all of them. There'll be hard choices to make, but there are things too. There are things that we can do in the short term, and there are also things that we have to fundamentally change in the longer term. So in the short term, for instance, for schools, we are going to look at opportunities of how much space you have between each other and from what age children will be expected to wear masks and things like that. And that will happen and will need to happen. There are more structural changes that we have to invest in as a society. How much hand washing facilities, running water do our schools have? How much have we invested in their sanitary facilities in every school? These things obviously can't happen overnight. And whoever owns schools in Nigeria. Federal government owns some, state government, private entrepreneurs. We then have to think about these structural changes moving forward. But these are hard decisions, but have become necessary in every sphere of life in terms of how we now focus on health protection, even in our hospitals. You'll be surprised. Is no point telling people to wear masks in hospitals where there's no running water in those same hospitals. So we're having discussions across the board. Miracles are not possible in this case. We have to start a whole reimagining how our hospitals, how our schools, our public places are organized in order to prevent the transmission of infectious diseases into the future.
Now, after the easing of the lockdown, Prof, NCDC introduced the public health guidelines, and we're beginning to see limited adherence. So, how is this affecting the fight, and what is NCDC doing?
So you're absolutely right, and I can also understand. We are such a we're a country where people love to mingle, to be with each other, to socialize. Yeah. So it's very difficult to tell people not to do so. And it's been, difficult to get the level of adherence that we want. And we continue appealing to all leaders in our society, especially in spaces where there's a natural leadership. So actually, people walking on the roads without a mask are not really a big problem, because transmission is much less likely in open spaces, right? So we're much more worried where people are in enclosed spaces, in churches, in mosques, in living quarters, in banks, in markets, in supermarkets. So wherever there's an enclosed space, and there are lots of people within that enclosed space, most of these people would have a leader. There will be a priest, there will be an imam, there will be a bank manager, there will be a school principal. So what we're really asking is the natural leaders of these enclosed spaces, wherever that is possible, to support us in implementing the measures that we have advocated for Nigerians to adhere to. And sometimes you need a break. You go outside, you take off the mask, and you come back in. But we may be tired, but like other leaders have said, the virus itself is not tired. So every time we get tired, it celebrates and moves from one person to the other. So yes, cases have come down, and we're grateful for that. But there are still cases every single day. There are deaths almost every single day. And we can't let down our guard, because we simply do not have the infrastructure to respond to a large-scale outbreak. So we've got to work very hard on preventing that from happening.
Well, we have five.
So across. Oh, go ahead.
Yeah, we have 5 minutes to go. There's several questions to ask, and I'm just Wiebe, you can take the next one.
All right. Yeah. So this has been a great conversation. We've packed a lot in, but you mentioned earlier about how many of the states are proactive and so on. I believe NCDC has units in every state, I believe. But how has the state response been? And have you seen states learning from each other and supporting each other?
Yeah, so NCDC is a new organization. So we actually don't have offices in every state, but we send teams to support the states, and we still have teams in every state. And, some states have been more responsive. I mean, you've been following the national discourse, and many states have been very innovative in what they've done and really led from the front. And I think I meet with the governors, a subcommittee of the Nigerian Governors Forum, very frequently. I think we have a meeting this night, actually, to discuss and agree on the measures and how to learn. But, the key thing from this is always remembering the structure of our country. We're a federal republic. No national parastatal has implementation capabilities at the state level other than working through the states. So apart from the military and the police, there's no command and control structure where we have the powers of enforcement. And actually, I don't think we should. So really, as hard as this is, it's about winning hearts and minds, supporting the states with expertise, with equipment, with knowledge, and then letting them drive the response. And, everyone talks about Lagos, but there are other states that have done very well in terms of driving this response from different aspects, where in Ogun, Oyo, even in the east, in the Plateau state, has been very proactive in terms of enforcing and implementing some of these measures. So I think there's been lots to learn from each other. Kano State, when we had that big outbreak at the beginning of the outbreak, everyone thought Kano would implode. But, really, the leadership of Kano really took the bull by the horns, brought in all the support they needed, and they had the most radical reduction in cases we've seen in any state. So there are lots of good stories to be told about this outbreak. I think it's too early to tell all of them because we've got to keep Nigerians on the ball. That this is not over till it's over, and we must not let down our guards over the next few weeks as we get to the end of the year, this year.
Yes, I know that the NCDC has launched an online course on infection prevention and control. That's very interesting. I cannot wait to get more information about that. But you see, some people are still sitting down and hoping that life will go back to normal. Like we're going to have is that possible anytime soon? And I'm going to clap that all with the last question back to back. That are we expecting any talk about the vaccine soon? How would you respond to those questions, as we go?
So I think your first question actually is interesting because when they say go back to normal, the IPC course is one of the things we don't want to go back to normal because we have found how adaptable, how much we can use technology and the internet to train. It's not something before everyone thought, okay, it's not possible, no internet, no, we've found that, listen, yes, we are not where we want to be. Not everyone has access, but we can do a lot more with what we have. So that IPC course is a perfect example of how do you get healthcare professionals trained up very quickly in a big country like Nigeria without traveling to every hospital.
That's right.
So, it's been a great example of one of the things that we don't want to change. We want to keep using technology to drive our messages. But absolutely, I would love to get back to the stage of partying, of celebrating, of hugging, of shaking hands. It's almost incredible to meet people now and not be able to shake hands. But,
so quick. Yes,
we will get there.
Prof, we have to run now. About the vaccine, is the NCDC currently supervising any local production or clinical trial of any sort? Nigerians would like to know.
It's not effective for us to focus on local production in terms of a global need.
Okay.
So the world has come together. We're part of a global coalition called COVAX.
Okay.
So both the development and production is happening in other countries. But my final word, this outbreak must inspire us, people, population, governments to reinvest in science. Science education is at the fundamental basis of vaccine development. We cannot address this from the top. We have to address this from the bottom. And I hope to see a whole generation of young Nigerians inspired to go into science, parents pushing their kids to go into science, and then that will ultimately lead to more Nigerians investing time, energy, and productive effort into things like vaccine development.
Thank you very much. If Femi Obong-Daniels were here, he would say the same. He would say thank you to you for joining us today, Dr. Chikwe Ihekweazu, DG NCDC. Wonderful job. Well done, gentlemen, for the job well done, indeed. Wiebe, we have to go. Our time is way fast spent.
All right, so let's just close this out. So thanks, Doc, for coming on.
Yeah.
This is the perfect way to round up this series. We've been doing this, I think, for 6 months now.
That's right.
Highlighting the amazing work of everyday Nigerians in their official and unofficial capacities to fight and lead Nigeria through this crisis. And you are at the forefront of that. So this is the perfect way to end. And thank you so much for the very clear answers. And I think there's a lot that the Nigerians will be able to learn from this. But final question. In the end, you're a Super Eagles fan. What are Tunisia, Algeria, are we going to win? And then we'll end.
I think there's a whole new generation of Nigerian footballers out there. I'm so proud and excited about the future. The challenge for all of us, you and I, is how to translate that energy that we bring into the pitch into every other aspect of national life in the country we hold so dear. So thank you for the excellent work you're doing.
Thank you.
Amen.
Thank you
so much, Doc.
Thank you very much, Wiebe. Thank you to Doc and every one of you that listened to the show today. God bless you. Well, we have to go now and bring you the news as Yvonne Ohaifo is on standby to read the news for you. Stick around. My name is Collins. Take care.